If you want to carry on your life and you want to just get on and do stuff, you know, it's not very, very easy to manage both. However, I persevered. One of the things that put me off about getting onto treatment in the first place is that I have very, very few peripheral veins. I was groin injected for 7 years out of my 18 years of injecting. I have very, very poor circulation. I also have type 2 diabetes. Within a very short time of starting the treatment, I developed an ulcer in my leg. Within a very short time of that, I then developed 3 more ulcers in my leg. Of course, the hepatitis treatment was suppressing my ability to be able to recover from the ulcers during the time that I was on the treatment. I was going to the wound clinic every week. Just really all they were doing was just a maintenance job. They were just patching me up and sending me out again, and they were saying it's not getting any better. In fact, we're a bit concerned, it looks like it's getting worse. And I said, well, I'm on hepatitis treatment. And they said, well, I don't know what that means, don't really know what the difference is to any of our other patients, which I think is a really interesting area and a really interesting issue. If I remove myself personally from this experience and start to think about it a bit more professionally, you know, the number of our clients or our service users who have been injecting drug users that have got very, very poor circulation and, you know, develop ulcers anyway, when you think about putting people onto treatment, maybe we ought to also be thinking about some of the other physical health care issues that come up. Anyway, I persevered with that, and after 6 weeks, I went along and saw my clinical nurse specialist, who said, oh, I've got some really good news for you. The virus is imperceptible. I said, what, 6 weeks? She said, yeah, the virus is imperceptible. You've got to carry on with your treatment, no? You've got to do the full 6 months. But, you know, their prognosis is really, really good. So I started to finally, after 6 weeks of what felt like, you know, nothing but an horrendous journey, get a little bit light at the end of the tunnel, and I thought, you know, that's not bad at all. 6 weeks, I know a little bit about, you know, what it means to have a good prognosis, you know, or a good diagnosis, even at that stage. So anyway, I stuck with the treatment. I carried on with it, and I saw it through till the very end. At 6 months, I went for my final appointment. Every grade 0, virtually. No, not quite, but you know, it was very, very clear. Booked my 6 months follow-up, and went for my 6 months follow-up, and was still absolutely clear. Just to rewind a minute, something that I wanted to really kind of highlight was that because of the history of injecting drug use and because of all of the stuff that I've said already about veins and lack of veins and stuff, one of the brilliant things about going for treatment where I did go for treatment was that my clinical nurse specialist said to me right at the beginning, how do you want to do things? And I said, well, what do you mean, how do I want to do things? And she said, well, is there any provisions that you think we should make for you? I said, well, I'm really bothered about having my bloods done. I've been to phlebotomy in the hospital many, many times for other reasons, and they stick needles in my arms and they stick needles in places where I don't have veins. And to be quite honest with you, it's a bit akin to feeling like I'm being abused when I go for bloods, because they won't listen to me. Every time I say don't go in the crook of my arm, don't go in my forearm, don't go in the back of my arm, they go in all those places and they don't get any blood out of me. She said, well, where would you like to take blood from? I said, well, as a matter of fact, I've got a good vein that runs down the inside of my left leg. I said, if possible, I'd like to take it myself out of there. She said, there's absolutely no problem whatsoever in doing that, as long as you don't mind me supervising you doing it. So every time I went for my bloods during that 6 months, I took my own blood. And I took it in a way that I knew was fine for me. It kicked up some old stuff for me a little bit, you know, sticking needles in my body again. I'd left that behind quite a way back in my history. But it was really, for me, that was I don't know whether it's kind of easy to transmit that to you, but for me that was an incredible thing to be able to get an agreement with the treatment service to allow me to take my own bloods, because I think that there was a point and a distinct possibility that I would have actually packed up treatment with everything I was going through, the ulcers, all of the sickness and all the rest of it, and then on top of that to have somebody saying, well, I'm going to take your bloods and I'm going to take them out of here, would have been the straw that broke the camel's back for me, I think. So anyway, it's a lot of pain. It's a lot of pain, but it's a lot of gain. I have to say, looking back now, I don't regret the decision to start the treatment. I've had a positive outcome. The future looks a lot brighter. I'm getting old, I've got diabetes still, not going to go away, but I'm not living also with the knowledge that I may well go on to develop cancer of the liver or cirrhosis of the liver as a result of hepatitis C infection. So I guess the message that I bring, really, apart from having the expert patient's title, which I think really amuses me. I've had so many hats in this business for so many years. I'm now an expert patient. I like that. I'll add that to the list of things that I've been called. Some of them not so wonderful, but so I really just wanted to share that with you, and I'm right on time, which is highly unusual for me. So thank you for your indulgence.